PCCD and OVS want to better inform and educate the field with the OVS Consolidated standards. Pennsylvania has long been considered a leader when it comes to these operational standards that are designed to maintain quality services and programming delivered by skilled advocates and staff. The standards are meant to be a guide to victim service providers, or VSPs, for best practices and excellent service delivery, provide minimum expectations for VSPs, and ensure uniformity of service delivery across the Commonwealth. The standards provide the minimum expectations of victim service delivery and ensure professionalism of the victim services field. PCCD and OVS has launched a series of recordings that will walk program staff through our standards. These will be short recordings, up to 30 minutes in length, posted on PCCD's YouTube channel. The OVS newsletter will announce new recordings as they are available. A prior recording, called Introduction to PCCD Consolidated Standards, is available on PCCD's YouTube channel. PCCD recommends listening to the introductory recording if you have not already done so. In this recording, we will highlight the therapy standard adopted by Victim Services Advisory Committee, or VSAC, in February of 2025. Programs providing therapy services within Victims of Crime Act, or VOCA, grant projects will need to have an approved therapy policy and procedure in place. Following this training, the program staff contact assigned to your grant can help answer individual questions about the standard in relation to your project. The therapy standard includes both traditional credentialed therapy and alternative therapy. Traditional credentialed therapy is a clinical process designed to assess and mitigate the long-term adverse impacts of trauma resulting from victimization. It is an in-depth intervention provided to victims of crime by professionally trained and credentialed therapists. Alternative and complementary therapies, or hereafter alternative therapy, are therapies that are not considered traditional credentialed therapy. Examples of alternative therapy healing include, but are not limited to, art therapy, music therapy, equine therapy, play therapy, and trauma-informed yoga. Therapy is separate and distinct from counseling and supportive counseling, which are short-term interventions. See Counseling, Supportive Counseling Standard. The delivery of therapy without the necessary education, training, and competency, or the failure to refer a client for therapy when needed, may expose clients to negative outcomes, fail to adequately address their mental health needs, and expose the Victim Services Program to significant liability concerns. Victims of crime are eligible for therapy services which can be provided by either therapists on staff or credentialed consultants. VSPs shall have a process for regularly screening all victims to determine whether a referral for therapy is needed and desired by the victim. There are professional requirements within the therapy service standard to ensure best practices and excellent service delivery to victims of crime. For agencies who provide traditional credentialed therapy, the therapy shall be delivered by a master's or doctorate level clinician who is professionally licensed by the Commonwealth of Pennsylvania and whose professional scope of practice includes therapy, or a master's level clinician who has completed their coursework is working toward licensure in the Commonwealth of Pennsylvania and whose professional scope of practice includes therapy under the ongoing supervision of professionally licensed clinician. It should be noted that for purposes of this standard, the term credentialed means that the therapist is licensed by the Commonwealth of Pennsylvania in their dedicated field of study, the license is in good standing, and the therapist has received the necessary training and education to include trauma training. For agencies who provide alternative therapy, the therapy shall be delivered by a master's or doctorate level clinician who is professionally licensed by the Commonwealth of Pennsylvania, licensed professionals who provide alternative therapies, example, music, art therapy, etc., must provide documentation of training completed in these modalities, or for alternative therapies where no Pennsylvania license exists, an individual with state or national certification in an alternative therapy program or style, example, equine therapy, play therapy, trauma-informed yoga, who has undergone trauma-informed training as approved by PCCD and shall be supervised, if necessary, on an ongoing basis by a licensed clinician providing traditional credentialed therapy as provided for in this section. Professional requirements also include that all therapists must have trauma-informed training and incorporate trauma-informed approaches in the delivery of therapy services. Therapists may be required to obtain additional threshold training or meet other requirements by the agency with financial or programmatic oversight of the VSP. For example, PCAR, PCADV, PCCD, or NCA standards, including meeting the 10 hours of training required annually by PCCD. A therapist is not able to offer services to a VSP until these additional trainings or requirements are satisfied. A copy of the therapist's current professional license or certification and proof of professional liability insurance covering the therapist shall be maintained in the VSP's files. To verify that therapy was provided, each victim's file shall include a notation for statistical purposes to document that the victim received therapy. Therapists shall follow all state and federal laws and the standards of the agency providing oversight to the VSP. Example, PCAR, PCADV, PCCD, or NCA standards pertaining to confidentiality of their clients and record keeping. For VSPs who follow the OVS consolidated standards, please refer to the Confidential Communications Standard as well as the Program Administration and Record Keeping Standard for additional information. When providing traditional credentialed therapy for post-traumatic symptoms resulting from victimizations, VSPs should strive to provide age-appropriate, evidence-based therapy services for clients. Examples of these types of traditional credentialed therapies include, but are not limited to, eye movement desensitization and reprocessing, or EMDR, cognitive processing therapy, CPT, narrative exposure therapy, NET, prolonged exposure therapy for PTSD, or PE, prolonged exposure therapy for adolescents, PEA, and trauma-focused cognitive behavior therapy, TF, CBT. When providing alternative therapy for post-traumatic symptoms resulting from victimization, VSPs should strive to provide age-appropriate, evidence-based, or research-informed therapy services for clients. VSPs are encouraged to research the effectiveness of alternative therapies through clearinghouses, for example, California Evidence-Based Clearinghouse for Child Welfare, the National Registry of Evidence-Based Programs, and practiced by SAMHSA, etc. Prior to implementation, VSPs are encouraged to coordinate with other VSPs to develop a comprehensive range of therapy services for victims of all crimes within the service area. Please email or call the program staff contact assigned to your grant with any questions. Thank you.